Hi there, this is Dr. Evan Ostar with Chicago Integrative Movement Specialists. Welcome to this newsletter where we're going to discuss osteoporosis and osteopenia and the exercise-related component to improving those conditions. In the last newsletter we talked about the nutritional component. Today we're going to focus on the exercise. And one of the most simple and easy things to think about with osteopenia and osteoporosis regarding exercise is the more weight-bearing exercise you can do and add external loads to at a safe level, the better they are for your bone and increasing bone density. So things like walking, running, resistance training, anything that puts loads on the body through the axial spine from the ground reacting into the body, or with external loads coming down on top of the spine, is perfect for building bone density. However, the challenge is many of our clients, many of the patients we see in our office, don't have good alignment, so they get joint conditions and problems and degenerative joint conditions because they're not lining the bones up properly and their joints up properly. In fact, we had a patient who had osteopenia on one hip, so she had decreased bone density in one hip, but not the other. And what we saw is as she was doing her lunge patterns, she would constantly cave in and shoot her hips out to the side. She was unable to stack her joints appropriately and keep herself nice and controlled. So rather than go through all the exercises you can do to improve bone density, I'm going to show you exactly how to line your body up so that when you do walking, jogging, resistance training, your body's in the proper alignment, both to save your joints, but also to help your bones increase their density. So the first thing we're going to discuss is the alignment of our spine. We want to think about somebody grabbing us from the back of the head and lifting us gently towards the ceiling to make ourselves tall. This is not tall, this is compressed. This is tall when somebody pulls us up and our rib cage is actually down. So we don't want to lift that chest up like this, keep that rib cage down, the spine long. We want to feel like we're tall through the pelvis, not tucking under, so not here tucking under, but long and level through the pelvis. And we want to feel like we're stacked over top our feet, not collapse, slight arches, and stacked over top the feet all the way up. So for example, during a squat pattern, I'm going to put my hand on my chest, and I'll tell my patients to put their hand on their abdomen like I'm doing here, and then do through a small squat while keeping this alignment. So I want to do a small squat. So again, align the joints, load the joints up with a small squat pattern. If your client, or if you as a client or a patient has trouble with their knees and or hips, there's many ways to modify this using a ball, using a smaller range of motion to help improve these patterns. So again, I'll do it to the side, hand on the chest, hand on the abdomen, line, stay long through your spine, sit back in your hips, and come back up. You don't have to go very far. All you're trying to do is line the joints up and improve the control of the joints in these load-bearing positions. Another great pattern for the upper body to start to increase the load through the shoulders, through the arms, is a push-up. And we can start with the wall push-up, the most simple of the patterns for the upper body. Again, align yourself on the wall here, align the spine, keep the rib cage down in the front, put your palms just a little bit wider than shoulder width apart, and go up on your tiptoes. And again, if you have any problems with your feet, toes, just keep a flat foot then. And all you're going to do is do a small wall push-up and push away. Again, maintain that alignment. Make sure that you do not lose control of your shoulder blades and or your spinal position. Because again, the key to improving bone density is resistance and weight-bearing activity. But the key to maintaining health of your joints and your soft tissue structures is to align your body properly so that you can perform the exercises that help us build bone density. So align yourself, breathe right, activate your core appropriately, then put external resistance, whether you walk, run, and or lift weights or do resistance type training. This is Dr. Evan Osar with Chicago Integrative Movement Specialists. I hope you enjoyed this newsletter. Take care. We'll catch you next time. Bye-bye.